thought of training. The EMS director could be the doctor, or the medical advisor could be the doctor at the hospital. We're hoping to make this work for everybody, and it would be created by the EMS providers, by our paramedics and our boards, to come up with something they think that could work and would be sustainable for Wilson County, and be transparent about it with the public and keep the public involved as we go along. That's as far as we are now. We're going to have another meeting mid-December to start talking with the EMS provider. So that's my report on that.
Any questions?
That's really kind of all I know, but I'm very hopeful. I will just say I'm hopeful, and if nothing else comes of this, the board, hospital board pretty much said we had to do this. I'm not sure what they plan to do afterward or if they're going to listen to it, but it was a good challenge, and I'm hopeful that something good will come out of it. Even if it's communicating to the hospital board what else can be done.
Well, all the other ones are participating in too?
We will. We're asking that. And this is just the initial 5, and we're pretty much looking at ourselves as facilitators. And Kay was there too, and I asked Kay to interject anything she would like to hear also. But we would be facilitators. And there are some expertise of people that have worked with EMSs before, so they could help guide where needed. I have a lot of contracts experience with shared services agreements and arrangements, and a lot of people bring good things to this group. And then the EMS people will bring the best part of it, the expertise of 40, 50 years of doing this in the county. So, did you want to add anything, Kay, or no? Yeah. Okay.
Ready to ask questions if anybody has any, but no.
Anybody have any questions?
So y'all formed a group to work with Connolly, or y'all formed a group to throw ideas out? I'm a little confused.
Connolly, Mr. Larry Richardson, more than once said for us to come up with our own plan and see if it worked better. I forgot exactly what the wording was, but so we're coming up with a plan independent of the hospital, because we still don't know what the hospital's plan is, in spite of all the, sorry Brian, all the slides and all the talk. We still don't know. I have found several strategic plans for EMS services online, so we could start with a strategic plan with input from you guys, from the EMS providers and the people that have done this forever. And it would be independent of the hospitals. And hopefully, the plan we have hopefully would incorporate some hospital services where it made most sense.
Any questions? Mr. Burnside has come from the hospital to discuss some equipment and try to get more info, I guess, for his planning.
Sure. Yeah, certainly. I think that what is developing here is very interesting set of situations. Certainly, as Ginger reports, there's now an alternate group coming together to put together an alternate plan, as has just been reported. I think that what the hospital has said many times is that we are confident with our approach. We're confident with our budget. We're confident with the assumptions that have been laid there, and we're trying to bring everyone together. That is what we're trying to do. But certainly in some of the meetings that we have heard, there's a lot of criticism of the plan, but not many alternate suggestions. And I know that was what Mr. Richardson's thought was because I was in that meeting, we know there's a period of time for criticism and constructive feedback, but what we encouraged the participants to do in our last strategic planning meeting was bring ideas. Bring ideas. So I think that's probably where that is coming from. I guess my point is that it sounds like the group here, we continue to debate, I guess, kind of where we sit. I think there's probably a series of decision points that would be helpful to outline. You know, number one, I know that we proceeded, the hospital proceeded, with the understanding that ESD3 did support a countywide service. You know, and I recognize that what I just heard in the minute discussion is we're not clear whether that's an official position or whether it's a, you know, a personal position. So
It's
I
never
think,
really been an official position,
Right.
you know.
right.
I mean, just canvassing individually, yeah, some of,
So I think that's one piece that we do need to sort out. I will definitely be presenting you with a resolution at one of your next meetings that will further give you, you know, some material to debate and to discuss and dialogue about. I think the second piece is there's a real colloquial misunderstanding of the idea of ESD3 going away. I want to be really clear and on record of my thought of that, because I think that is being very much misinterpreted. Clearly, number one, the ESD cannot disband without a vote of the voters. I mean, that is a secondary issue. The second thing that I have suggested is that probably the ESD3 would want to, you know, maintain a board function, maintain an oversight position, or at least a monitoring position for the Conley plan, to make sure that your citizens that you represent are being well taken care of by the Conley plan. So this idea of the ESD going away on October 1st, that's not our intention, nor would that be prudent for your standpoint. What I think is valid to say, though, is that when we work together to hire paramedics, obtain equipment, obtain garage space, that your operating expenses would be next to zero. That truly, while you may not go away as an organization, nor would I want you to go away, I would want you to maintain the monitoring for your citizens, your actual operating expenses would be essentially next to zero. And that is where the idea of reducing your tax rate to zero and benefiting the residents of this community comes back into play. I think I can throw one more element about why I feel confident putting a zero tax rate or a near zero tax rate, as I said verbally, for 2018, is this next piece of the equation, is outside of all of the alternate planning and alternate discussion, I did receive guidance from my strategic planning committee last Wednesday, and you saw that the last line of the newspaper, to continue to proceed forward. So what my intention for today was to come and begin to ask how you would like to address the idea of a transaction, a theoretical transaction, to be executed at some later date, but a transaction that would allow me to pay fair market value for your equipment, pay a fair market value rate for garage space and other space here, and using the intergovernmental transfer process, figure out how theoretically a transaction would take place in the event that you not only support the countywide service, but you support the Conley service as the weeks and months continue to pass. So what my presence today was designed to do was to start the dialogue around how would you value your rigs, how would you value your equipment. I know the conversation about existing debt is a concern. I am not aware of that number. I don't know how much that is, but to me, again, that's another operational item that would factor into this transaction, intergovernmental transfer transaction. And to me, the proceeds of that transaction would also help your next to zero operating expenses beyond October of 2017. So that's a lot of verbal description of that. I didn't come with slides, I didn't come with those types of things, because I just simply wanted to lay that thought out. I can use the whiteboard, we can do whatever, but that's kind of the place I'm at today, is trying to ask Do we have the full board have that conversation, a subcommittee? Do Dave and I work together? How would you all entertain how we begin to structure the potential transaction that could take place sometime in the future?
I mean, me personally talking, and with the board here, I see a transaction of us, the board getting together, almost having like a workshop. And, because, yeah, we owe on one ambulance, two monitors.
The only debt that we have is an ambulance
And the two
and
monitors.
cardiac monitors.
Right. So, I mean, I don't know, I may be different from a lot of people, but I'm here to service the county, and in this case, ESD 3.
Right.
And the whole board is, I'm sorry, I shouldn't say that. We are here to service the county. But my personal deal is that as long as that equipment, it would be similar to what we had prior to us actually taking over Stockdale, you know, whenever we contracted to Stockdale. I would see that almost like that, is that, okay, now we're gonna contract to Conley, and you don't stop me anytime and ask questions. Us providing y'all with the equipment would stay ours. Y'all would, in this case, make all the payments, maintenance cost and all that. The equipment would remain ours as long as we're in, you know, we're established as ESD 3. Now, like I said, we would have to have a workshop. I mean, that's my theory is the way it should work.
Sure.
You know, I don't see us charging the taxpayer any more money or anybody else any more money. I mean, if I can keep the cost down for Conley, or if we can keep the cost down for Conley, but still get the service provided, what we have now, the quality service, the paramedics on every truck and all that, that's to me, that's our goal.
To me, we've just ignored everything we've discussed here. The board doesn't have a position on whether we can support this yet. We're jumping to entering into an agreement to sell or lease the
No,
equipment.
we're not in,
Okay.
we're just discussing it.
Okay, I see.
I mean, you want more input.
Just to get that
Y'all are
clear.
asking for more input. The more input he gets
Okay.
on about how things might
Okay.
work, the more input he can give to the citizens.
So what Mr. Burnside is saying, if and when we get an official position and we agree to this, then at that time, this is what we might do.
Well, what I'm saying,
that what you're saying?
what I'm saying, Ginger, is I feel that we should spend a period of time working through the idea of what a transaction would look like. Is it a hospital lease of equipment owned by ESD 3, which continues to operate, you know, continues to exist with no operating expenses, you know, however that looks at a fair market value, I'm open to exploring with you. And, you know, we will work our way through it, because your goal and my goal are the same, Mr. Chairman, is that the residents of this community and the community across the county will receive mobile intensive care unit service 24 hours a day, 365 days a year. And that has been our statement and plan, not only for the Stockdale area, but for the entire county.
And the other thing is that you need to, that I feel y'all should put out, is start looking at and putting out kind of exactly, I know you don't have your director yet, kind of where each of the, you know, all the stations gonna stay the same to start off with. And I mean, I think that, you know, that's what your plan is, but you need to actually put it out in writing that, yes, or, you know.
You know, that certainly is our plan, and we're finding that some services, you know, perhaps like ESD 3 are very open to that. You know, other services may not find the idea of us using their equipment as an option, so we'll have to come up with some other arrangements in that regard, and we're very willing and able and capable to do that.
And if I may, the facility part of this facility belongs to the city. We have an agreement with them, they allow us to use the facility, so you'll have to meet with the city council.
That's a fair point, David, thank you. That right there is a great pearl of kind of unknownedness, that as we start having discussion and start having some more detailed review, those things can come out, and we can make sure that we're doing the right type of transaction And that's what I was here today to request, is how do we start having those conversations? Outside of the idea that there may be alternate plans, outside of the idea that there may be other arrangements, with other plans, I suppose. I wanted to just proceed with the idea of at least engaging in what does a transaction potentially look like.
Speaking of facilities, on your budget, I'm seeing that you've allotted for each garage lease $500 a month. You've budgeted $500 a month to lease a facility similar to this, and $600 a month for all the utilities, the phone, the internet for each facility. That's $1,100 a month. And David, what does it cost us here? We don't have to pay because we're.
We don't pay utilities,
But
we
what
don't
it
pay
should,
for facility.
do you think $1,100 is reasonable for rent and all the utilities and internet for?
Well, he's trying to figure all of this out. I mean, I think if he works out an agreement with the other agencies, I don't think that they're gonna, I mean, our common goal, our end result is for the citizens of the county,
Right.
not to make money off of it.
Right.
And so, yeah, I think it's possible.
I think it's possible. There are just some, in fact, a number of things in the budget, which I'll get back to that at another point when we're ready, but that don't make a lot of sense. And so we're talking about going to implementation of this, or talking about implementation of this plan by getting the equipment. We still don't know the steps that would lead up to that. And I even talked to Mr. Hiddle after the meeting on November 30th and said, give us something. Give us something that shows us what your plans are, what your steps are. There's not anything, so we don't know what those are going to be. I know I keep saying that, but we don't know what they're going to be, so I don't know how we can make a decision, and we're not talking about making a decision right now. Why we're jumping to taking the equipment over, which
That's
is not a
what we're
bad
jumping.
discussion.
I'm inquiring about how
Right.
to
And I'm saying it's not
understand that.
And it's not a bad discussion. There are some other things out in between that maybe we need to talk about, or maybe you already have plans for. They said many times during the meeting that these are the plans, but it's not transparent to us what they are. And we just want to understand.
And I think,
A lot of us.
I'm gonna defer to the entire board here because we undoubtedly want to make sure that everyone is aware of what our plans are and how this works. We continually have this debate about, is there a plan, is there not a plan? And that has been one of the resounding conversations over the last several months. Our board clearly stated last Thursday that we believe that we have enough information to proceed and move forward. Again, I believe I have, Ginger, we have talked about obtaining 8 ambulances. We've talked about having 4 primary units and 4 secondary units stationed throughout the county, presumably in the existing locations. We've talked about the practice of hiring a director here in the next several weeks and beginning the application process. We have talked about the idea of hiring staff at good wages between the late spring and the starting point, pulling in your feedback about making sure that when we get to the transition point, we're being very mindful of what September looks like. We intend to be using up to 30 days of training period, to try to make sure that everyone is up to speed and ready to go. We have a budget based on both emergency runs and transport runs. Certainly the EMS services are very much aware of the EMS volume, but the hospital is hearing over and over and over from nursing homes the tremendous need for transport volume. So that is a factor of our plan. We presented the budget that outlines dollar for dollar, where we intend to spend those dollars. And I think that we can talk about is the rent payment enough, is the telephone expense enough? But the reality is that our board, not just Brian Burnside, our board believes that if there is a margin of error in the budget, it's still tolerable for our organization to absorb those expenses. And so we've laid all these things out, And I'm not really sure how else to describe the plan, other than we're going to hire a director, we're gonna go through the license process, we're going to hire a medical director who's already, you know, theoretically contracted with us. We're gonna hire and train staff, and we're gonna obtain ambulances through transactions of this nature or of other types, and complete that work between now and October 1st, 2017. And what is happening in my chair is that we certainly hear the debate and we're responding to that. However, my job is to keep moving forward. I'm not only being directed, but I also believe that if we're going to make this become a reality, I need to keep moving forward, and I am, which is why I'm here today, again, to begin the conversation about how that transaction could theoretically take place to be executed sometime well in the future.
And I think you're doing a good job, personally. It's not easy because you're dealing with county residents. I just went through transferred from, I worked for Metro for 15, and Acadian took us over. And that transaction, well, I didn't have anything to financially or anything else involved. And that was a huge company taking over a smaller company, but the smaller company still had 20 ambulances running a day, 7 days a week. And another company that's had only 20 ambulances in San Antonio covering Bexar County 911 service. And it's not that, once everything's figured out, it's not that hard of a transition. We came in on November 16th, we changed uniforms, we got into a different truck that said Acadian on it, and we went on about our business. And that was 100 and something employees that did that. That's all. There was no huge, we did 30 days of, or 40 something hours of training on Acadian after work, 30 days prior to all this happening.
The company that took you, was it an ambulance? It already was an EMS provider?
Yeah, it's a very big provider, yes.
So they had the experience and knew how
Well,
to do that?
it's not that big of a deal. They came in and trained, just like he was saying. They're gonna hire the employees. They're actually probably be working for 2 different companies. That's what we did. We were part-time for Acadian while we went on training, and then we were full-time still at Metro. And whenever that 16th, November 16th, we just came in at midnight, changed clothes, and got back on the truck and finished our shift.
I won't belabor this, but there's a big difference to me in that company that took you over had years and experience and know how to do this, and this is a hospital.
I understand, but I think we're making this more complicated than it really is.
I won't drill too much, I'll let you say what you wanna say, and I'll.
Well, I'm just saying, I think I'm making it more complicated than it really is.
He's getting how we would like for our equipment, if this were to take place. There's still that if in there, but the hospital has to be ready that, okay, are we gonna lease the equipment from the ESD, are we gonna purchase it outright, or how we're gonna do it? I mean, we can't be left with any expense if we don't have any income coming in.
Well, it is an important discussion.
You're right.
Yeah, and the last thing you wanna do is wait until October 1, 2017 to have these discussions.
I agree, it's
And,
important.
and the more information that we give the hospital, the more they can put out. Like I said, one of the biggest thing is you may wanna put out is that, where the stations are gonna be, at this time.
Sure.
There again, just like any business, you decide and make plans, and then you have changes. That's with any business plan.
Well, just let's speak specifically of Stockdale, to the degree that a transaction could be structured appropriately and to your satisfaction, our intention is to use this location and this equipment. There's no other intention any other way. So if unfortunately if it couldn't happen, we would do something different. But I'm very comfortable to be on record with you saying my intention would be to work out an arrangement with you all, because it's the most natural, you know, there's not a lot of rigmarole with it, it all already exists. If I could just kind of make, just a couple more comments, I want to continue to say the definitive statements that I've said many, many times. Number one, our overall goal is for the health and wellness of Wilson County, including the residents of ESD3. We will provide mobile intensive care unit coverage across the county 24/7, 365. That is not available right now in all areas across the county. We will, I do believe that the best people to provide this care are the folks who are already doing it, who are most qualified, provide great patient care and are current in their competencies and such. Those people who choose to apply with us, who meet those standards, will be the folks that are most likely to be joining our team in the future. And then, finally, I think that this whole project again continues to revolve around patient care. We want to make sure that all residents of the county, regardless of where you live, have that level of access to great EMS service, and our goal is to help make that happen. So, those continue to be the same definitive statements that I've made, from when this began, and want to continue to provide that reassurance both to this board and to the community at large that that's our goal.
Well, I mean, the board is willing to work with the county and Conley any way we can, and I think this is a good start. We need to have a workshop on exactly how we want to do it.
I'm with Carl. Our main thing is, I think it's saving money and not having to go out and buy him and stuff, but it also help us, like I said, if you take over what debt we had, but we still maintain ownership, hopefully it'll all work out. But if it didn't, when it all comes back and we're still the ESD3 need provider service, we don't have to go out and buy ambulances again. We just take it back. I want it for everybody, but we're for ESD3. I mean, that's what we're here for. The others, if they don't want to do like we did, they want to just turn it over, that's fine. But like you're talking about an ending game, in case the ending game been how we want it to be, we're not left with nothing to start over with. We're not having to go out and try to buy ambulances and all this stuff we've already done. But I think that also saves you. You're not having to come in here and write us a huge check for 3 ambulances and all this other stuff. That's kind of where I'm coming from. I think that's where Carlos is coming from.
I agree with that. It's amazing how aligned our two philosophies are on that right there. I mean, I think that we're just about saying the same thing without having an actual transaction on paper. I mean, I think that's our goal too, is how do we minimize the cost of action plan number 4, which is obtaining ambulances, and then the reality that ESD3 will continue to exist while it may not continue to operate the service.
Yeah, operate the service. Correct.
I mean, to me,
more of an oversight
yes,
than anything
yes,
else.
sir. To me, all of that, just factors into putting an actual transaction on paper. You would almost
My
totally align
deal
with
was
that.
our personnel, to me, is how was it going to affect them, and I don't foresee any trouble when you go in there. I mean, we haven't had any turnover. We have great times. Everything's good. I really don't think that'll be a big problem. But
Well, I really want to comment. As I've studied all of the services, there is no question that you all run a great ship here.
we
There's just
don't
no
run much
question.
nothing. We meet and they do all the work. That's basically what it turns out to be.
So that was my point for today, was trying to figure out how we open the conversation about potentially designing a transaction to be executed at a later date,
Right.
but at least getting that worked out.
Now, let me ask you this. If the others they're just absolutely gonna do it, are y'all gonna still go in and say, well, we'll do our section and then do ESD3, or is it an all or nothing, or do you have a plan for that? What?
I'm gonna comment, at this point, we don't have that contingency built.
That's what I didn't know whether.
We just don't have that contingency built right now. I think that we're still of the belief that we can pull this all together, and so I don't think we've considered the idea of
Two-thirds,
continuing the
half,
piecemeal
right,
situation.
right.
So I'll have to kind of put that in my thought process, but I don't think we've explored that contingency yet.
Well, I know if it, however which way, you know, whoever's got service and the others don't, the others are gonna be mad and upset, and, but there again,